A ballot over strike action among staff at the Avon and Wiltshire Mental Health Partnership Trust is underway in the long-running dispute over the restructuring of services. UNISON fears the changes could result in pay cuts of more than 12% and the loss of some 50 posts. Now, earlier I spoke to Mike Sweetman from UNISON South West, who described the background to these issues.
Well, the idea of a review for administrative services in AWP Mental Health Trust has been going on for a number of years. But it was really the proposal that was published on the 1st of November, which caused this issue to really start becoming much more heated, because that was when the Trust published the numbers in their proposals, which showed that they were going to remove a very significant number of the staff who are currently Band 4. They were going to remove those jobs from their existing structure and replace them with lower grade jobs. So really, ever since November, these staff have been very sort of distressed by that proposal. And have been campaigning against it. We had demonstrations outside all the workplaces at lunchtime back in November, and we've had numerous meetings with the Trust since then. But as things currently stand, the proposal has still not been withdrawn or changed in a way that we think our members will be happy with.
So, just to clarify, your worries are that quite a lot of jobs could go. The band that you mentioned, what type of people would work within that band?
We're talking here about medical secretaries, team administrators and ward administrators in inpatient services, and in mental health services. We're not talking about highly paid executive staff. The people who are most affected by this proposal, although not the only people, are the people who are currently on NHS Band 4, where a full-time member of staff is paid less than £24,000 a year. So these staff already earn below the average earnings in the UK. And if this proposal goes ahead, they will earn even less. They will have their pay cut by £3,000 a year, full-time equivalent, which amounts to more than 10% of their current pay.
Will this affect users of the mental health services? And if so, do you think the changes will affect the delivery of those services and therefore, the quality and safety of care?
We believe that in the long term it will, because, of course, if you have less administrative staff and if your experienced administrative staff leave because you've cut their pay, then who's going to have to pick up the admin work? It's going to be the clinical staff. The workloads are already high. People don't feel there's capacity for them to take more work on. The service is already stretched, and it will be more stretched if this goes ahead. So, we think they'd be better to keep the experienced staff they've already got in the roles they've got, rather than increasing workloads and expecting clinical staff to take time out of their duties to cover more admin work.
If the Trust doesn't change its stance, how will your action continue? Will you be stepping it up?
Well, we sent out formal ballot papers to our members yesterday. So there's currently a 3-week postal vote. As your listeners may be aware, trade unions are only allowed to vote by post, and we're not allowed to have online votes or votes in the workplace. So that vote is open for 3 weeks. It will close on the 22nd of May. And if we get a yes vote with a high enough turnout, which we're confident that we will, then we will consider whether to be taking industrial action, which could start as early as June. Obviously, we don't want that to be the case. We hope that the Trust will change its mind and see sense and withdraw these proposals, or significantly change these proposals before that becomes necessary. But since this issue has already been going on since November, we feel that it's now the time to step up the action in the way that I've just described.
And so if there are strikes in June, how frequently are they going to be, or is that still something that's got to be decided?
That's not been decided yet, but I think in order for it to be effective, for it to have the impact that we'd like to have, I think we'll be talking about more than one day. But the specific details are not decided yet. That's something that will be up to a group which comes from the affected members. So the decisions like that will be up to the people who are actually taking that action.
Mike Sweetman from UNISON South West talking to me earlier. Now, in response, Hayley Richards, the Chief Executive at Avon and Wiltshire Mental Health Partnership Trust, sent a statement which said they would like to assure everyone that despite the statement from UNISON, they're not pressing ahead with any of the proposed administration restructures whilst they're in dispute with UNISON. And the Trust added it recognised the review and the continued delay of implementation was causing further stress for all those involved. It appealed to UNISON to work in partnership with the Trust and stop miscommunications about the process and the reality of the Trust's position.